Introducing the Pink Hip Kit from Xodus Medical. An innovative new system that allows for safer hip distraction without the need for a perineal post, eliminating any risk of nerve compression injury or tissue trauma in the perineum, helping your facility comply with CMS never events for avoidable injury. This more natural, streamlined distraction process further reduces postoperative pain, recovery times, and potential dependence on prescription pain relievers, improving both patient safety and satisfaction. The Pink Hip Kit enhances range of motion and joint manipulation, permitting a more complete dynamic exam without any change to surgical technique. The absence of the post also delivers unobstructed visualization and access in C-arm imaging, yielding more thorough and efficient fluoroscopic exams. With the Pink Hip Kit, patients are enveloped and immersed in the same unique patented material that revolutionized patient positioning. This skin-friendly material permits airflow and wicks moisture, eliminating post-operative skin redness, an early indicator for pressure injury. The Pink Hip Kit safely provides counter-traction required to offset the force of tibular distraction, gently holding the patient in place, instead of leveraging the perineum against a rigid post. No contact with a post means no groin injury and no associated complications. Best of all, the Pink Hip Kit is available for your existing surgical equipment, allowing you to forego the capital expense of a new dedicated system to achieve postless hip distraction.
When I decided to transition from a posted system for hip traction to a postless system utilizing the Pink Hip Kit, one of the things that I considered was purchasing an entire new hip arthroscopy setup. Well, most hospitals, including mine, have spent tens of thousands of dollars to invest in a specialized hip arthroscopy table and bed. And when you talk to your administration or your colleagues about purchasing a new table that may cost upwards of $100,000, that's a difficult discussion to have. The benefit of utilizing the Pink Hip Kit in this situation is that you can use the same table that you've been using without transitioning to tens of thousands of dollars in expense. We are now able to achieve the same surgical outcomes with less risk of complication without costing more money to the system or increasing the cost to the patient.
It's adaptable to whatever table system you're currently using, and you can use your exact same operative technique, which was a big advantage in my mind over some of the other systems.
Without having the post in the way, it's far easier to manipulate the C-arm and get the view that we want perfectly. So now we can get a very thorough osteochondroplasty of the femoral head-neck junction. It's made our lives a lot easier, both from a quality perspective and a technique perspective.
With the post eliminated and using the Pink Hip Kit, it can really permit you a full range of motion with flexion, extension, internal, external rotation, and abduction and adduction.
Now, as my traction times have gone down and I've eliminated the use of the post, I have noticed that patients have started rehabbing quicker and have less pain early on following surgery than I did previously. Certainly removing the post has increased patients' ability to get up and move more quickly. And so if we can eliminate the discussion of the complications and eliminate the pain in the groin, eliminate some of this numbness, the patient's perception of their outcome is significantly improved, and many times their pain is significantly improved, which is a benefit for everyone.
So I've now performed hip arthroscopy on a few patients in which we've done one of their hips with a post and their other hip without the post. And the way this originally came up was there was a patient in which we did her right side with the post 2 years ago, and then we had just done her left side approximately 3 months ago. And one of the first things that she told me when she came in for her initial post-operative appointment was, "What did you do different this time that you didn't do the time before?" And the first thing that I said was that we use this new system that's called a postless system, which we didn't use the post. And she said, "My pain was 0. And that's something that if you can reduce that early pain by using the Pink Hip Kit, then that is one of the biggest advances that we have in our hip preservation techniques, because we can make our surgery safer and make our surgery better.
So it's been a really nice advancement for the field, and one of those advancements that truly does improve patient safety and quality.
The Pink Hip Kit offers postless distraction on existing tables, affording you faster, easier distraction with better patient outcomes, while completely eliminating post-related groin injury on a multitude of hip preservation and repair procedures. To learn more or to arrange a trial, email us at thepinkhipkit@xodusmedical.com or call 724-337-5500.